Human metapneumovirus, or HMPV, is a common respiratory virus. It's quite similar to the respiratory syncytial virus, often known as RSV. HMPV can infect people of all age groups. However, it poses a greater risk to young children, older adults, and individuals with weakened immune systems. These groups are more vulnerable to severe complications from the virus. HMPV is a significant contributor to respiratory illnesses worldwide. HMPV was first discovered in 2001. It is a relatively new virus compared to other common respiratory viruses. Despite its recent discovery, HMPV is now recognized as a major cause of respiratory infections. Globally, the virus spreads rapidly, especially during certain seasons. HMPV is an enveloped, single-stranded RNA virus. It belongs to the Pneumoviridae family, which also includes RSV. The virus primarily infects the cells lining the respiratory tract. This leads to inflammation and various respiratory symptoms. Understanding the structure and behavior of HMPV is crucial for developing effective treatments and preventive measures. The discovery of HMPV has significantly impacted our understanding of respiratory illnesses. It has highlighted the complexity of respiratory infections and the need for continued research in this area. As we learn more about HMPV, we can develop better strategies to diagnose, treat, and prevent this common and potentially serious virus. Human metapneumovirus, or HMPV, typically presents with symptoms resembling those of a common cold or the flu. These symptoms may include a runny nose, cough, sore throat, fever, and wheezing. The severity of these symptoms can vary greatly from person to person. Some individuals may experience mild cold-like symptoms, while others may develop more severe complications. In severe cases, HMPV infection can lead to bronchiolitis or pneumonia, particularly in vulnerable populations. Bronchiolitis is an inflammation of the small airways in the lungs, while pneumonia is an infection of the lungs themselves. These conditions can cause difficulty breathing, chest pain, and a high fever. In some cases, hospitalization may be necessary. HMPV spreads primarily through respiratory droplets produced when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect others who come into contact with them. Transmission can also occur through direct contact with contaminated surfaces such as toys, doorknobs, or hands that have been in contact with respiratory secretions. The virus is highly contagious, and individuals infected with HMPV are most contagious during the first few days of illness. However, they can remain contagious for up to 2 weeks after symptoms appear. It is essential to practice good hygiene and avoid close contact with others when experiencing respiratory symptoms to prevent the spread of HMPV. Diagnosing human metapneumovirus, or HMPV, can be challenging, as its symptoms often mimic those of other common respiratory illnesses, such as the common cold, the flu, and RSV. This similarity in symptoms makes it difficult to distinguish HMPV from other respiratory infections based solely on clinical presentation. To confirm a diagnosis of HMPV, laboratory tests are often required. Polymerase chain reaction, or PCR, is a common laboratory test used to detect the presence of the HMPV virus in respiratory secretions. This test is highly sensitive and specific, providing accurate results in a timely manner. Currently, there is no specific antiviral treatment available for HMPV infection. Treatment typically focuses on managing the symptoms and providing supportive care to alleviate discomfort and promote recovery. This may include getting plenty of rest, staying hydrated by drinking fluids, and using over-the-counter medications to reduce fever and relieve pain. For severe cases of HMPV infection, hospitalization may be necessary to provide respiratory support. This may include oxygen therapy or mechanical ventilation to assist with breathing. While there is no cure for HMPV, supportive care measures can help manage the symptoms and prevent complications. Preventing the spread of human metapneumovirus, or HMPV, relies heavily on practicing good hygiene measures. These measures are crucial in reducing the transmission of the virus from person to person. One of the most effective ways to prevent HMPV infection is through frequent hand washing. Washing hands thoroughly with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating, can significantly reduce the risk of infection. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used as an alternative. Covering coughs and sneezes is another essential hygiene practice to prevent the spread of HMPV. When coughing or sneezing, it is crucial to cover the mouth and nose with a tissue or the crook of the elbow. This helps contain respiratory droplets and prevents them from spreading to others. HMPV infections typically peak during the winter and spring months, similar to other respiratory viruses. This seasonality highlights the importance of being particularly vigilant about hygiene practices during these times. By following these simple yet effective hygiene measures, we can collectively contribute to reducing the spread of HMPV and other respiratory infections.